Yes, Dr. Sagar, the floor is yours. You can start your next section.
Thank you for this opportunity as well, and welcome everyone for this wonderful platform. My name is Sagar Damala. I'm working as a clinical fellow in Kingsmill Hospital, which is a steroid NHS Hospital Foundation Trust based on Nottingham. I'm working as a clinical fellow, which essentially means I'm in a non-training job. I've completed my PLAB. I've got GMC registration through PLAB route, and I was graduated in Nepal back in 2018. As Siddharth as basically updated everyone like how to get registration and all, so I'll be focusing on just on NHS job application and non-training job itself. So first of all, NHS job application. So once you are GMC registered, then our next thing to do is job application to work as a doctor in UK. So all the most of the applications are online application. So we do not need to write any things on the paper or anything. It's just an online application, and it's free of cost. Unlike US MLE or anything, we do not need to pay anything for the job application. And the most popular site used for the online job application is NHS Job and Track Jobs. However, there are other forms as well. If you are, if you can register yourself as a British Medical Association member, you can get job application from BMA magazine as well. Right now, you know this job application, it does not only necessarily mean that there will be a job for a SHO level or anyone. So basically NHS job or track job, this can include jobs for everyone, including doctor, nurses, allied health professionals, uh, you know, for everyone, consultants, F1, F2, and everyone. So the most common citations to look for is these ones: foundation year 1, foundation year 2. All of this essentially means that these are junior doctor categories. So you can basically search any of these. You can use any of these words to search for the job as well. Right. So there are a few steps that needs to be filled up. So in both NHS job and track jobs, there are a few sections which needs to be filled. So it basically means that we are filling out those sections, and it will we have to do that in order to apply for the job itself. And this section consists of personal information. So personal information means the name, address, visa status as well, GMC registration status as well. So visa status means if you're still in UK, you can put a UK address. Even though you are on a visit visa, you can put down as an visit visa status, because by that it will be an understanding that the candidate is still in UK, and you can change your visa from visit visa to tier 2 visa while still being in UK. And also GMC registration status means that either you're waiting for your GMC registration, or you've already got your full GMC registration and license to practice, or you've just got GMC registration and do not have license to practice. All this essentially means that what is your status at this point. And the next section would be qualification. So qualification, in my case, I started from the school level. We call it as a school living certificate in Nepal, and 10 plus 2 after that, an MBBS. So all your qualification that you've gathered throughout your career, if you've completed your post graduation program like MD or MS, you can include that in here, and it would certainly create an impact if that's relevant for the role that's provided. And once also in the qualification section, you can also put which year it was completed and what's your grade in that as well. And after that, there will be a relevant training courses section where you can write down all the relevant training courses that you have attended. In my case, I attended BLS and ACLS, which might not be relevant for UK, because there are different resuscitation councils, but still, like, I wanted to create an impact. I wanted to, so that I included that in my relevant training courses. Otherwise, if you've got any kind of relevant training attended online, offline while you're in medical school, you can include that, and you can include as many as you can. There is, or if you've got less, no worries. The other section is employment history. So what I would suggest is, here in UK, the graduation happens first, and then there is F1 and F2. However, in back home, in Nepal especially, we do our intensive, which is equivalent to F1, and then get graduated later on. So I would say in your employment history, put internship or FY1 as an employment as well. So just write in brief about what did you do and what was your role. So employment history would include like who was the employment provider, mention your medical college name, and after that, address of your medical college, contact address, and your rotation in a specific department, and what were your day-to-day activities and all. So after that, if you've done a house job, or in back home, you can include that one as well and write down employment history. So while writing an employment history, I would suggest to be very, very, write it in a very, very briefly. I mean to say that so create a background first, like make them understand what kind of hospital is that, what kind of setting is that, and what are the day-to-day practice there, what are the normal clinical scenarios there, and making and outline your day-to-day activities, even if it is smallest, you know just outline it, so that they would understand what kind of job you are doing. Once you've completed employment history, then the other section is referees. So referees generally means that as in you there means they're relevant, your seniors or whoever was responsible, or whoever can assign you that you did work during that time. These are the generally referees. I put down as in my consultant in my referees as an employment history. The other section is supporting information. So I will talk in detail about this in my later in my another slide, but supporting information is the main section for job application itself. So you'll be talking about why are you relevant to the job, and why do you think that you kind of fit into the job role, and what are your how do you, and also how do you fit in the role as well, and what are your further plans. We write in a very detailed way in that, in supporting information. There are other sections as well, like teaching experiences, audit, and article publication. If you've got any of those, you can include that. It would create a positive impact, certainly. Now, tips for good job application. First of all, I would suggest start early. After you've completed your PLAB 2, and once you've passed your PLAB 2 and you're still waiting for a GMC registration, I would suggest start applying for the jobs. While applying for the jobs, I've heard most of the things in online and everything, as apply as many as you can. However, I would say focus on quality rather than quantity. So while applying, take your time and understand the trust values and understand the trust principles first. Understand what kind of person they are seeking for, understand what the role they are asking for, and look around and think about yourself, and write down in such a way that how you fit into that role. So let's say there will be a certain things called personal specification and job description, and there will be certain things like essential or desirable criteria. So let's say essential criteria is GMC registration, and desirable criteria is previous NHS job experience. Although you might not have desirable criteria, or although you might not fit all the criteria, still apply for the job, and demonstrate that what is your future plan, and how would you fit in the role in the future. None of the people, none of the most of the candidates would not have all the criteria, and essentially meaning, and having all the criteria doesn't necessarily mean that you'll get the job. It's about how you demonstrate yourself, how you sell yourself there, and also demonstrate your skills and abilities accordingly, mostly in supporting information. For example, let's say if they would say, if the trust values is about team working, it is about patient safety, then explain your abilities and explain how you are a good team player, explain how you put your patient first. Similarly, and the reason I'm saying mostly in supporting information is, generally once we do a job application, it will be screened by HR, which is human resources. Most of them are non-medical, they come from a non-medical background. So whatever good ranks that you put in the first place, or whatever post graduation that you have done, might not necessarily make a good impact as supporting information, because once they read the supporting information, they will understand if the person would fit the role properly or not. And once you have screened that and you have selected for the interviews, then you're more closer to getting the job. Now, the interview itself. So once you get an interview, it means that you're very close to very close to getting a job. Now, the interview, it differs from trust to trust. With my experience, there will be at least few interview panels from medical background consultants, at least one or two, and one of them and few members from the HR as well. So the interview generally, it might differ from trust to trust and define for experience to experience, but this is a general outline how an interview would occur. So first thing they would ask you about is about yourself. So again, similarly how you write in supporting information, how you demonstrate yourself there, while talking about yourself in an interview, demonstrate that you know the trust values and demonstrate that you are a fit candidate for them by saying that you kind of meet the essential or desirable criteria. So if you've not met them, you might show your future plan and how to meet them in future. So another question they might ask you about is audit knowledge and experiences. It doesn't matter if you've not done audit or clinical research or any kind of publication in back home. I mean, it does matter, but what it mostly matters is your knowledge about it, your understanding about it. So read thoroughly what an audit means and what your understanding means. Even if you have not done it, you can outline your knowledge and you can impress them. After that, it will be followed by a clinical scenario, which may be few, one or two, which is very similar to PLAB 2 scenario basically, and also an ethical scenario, which is also similar to PLAB 2. Always use ABCDE protocol and and demonstrate that you are a safe doctor. And lastly, they will ask you if you've got any question for interview panels. I would recommend to prepare some questions for the interview panel as well. Prepare questions like ask for if will there be any shadowing period or will there be any supernumerary period, what kind of support there would be for you in the future, and so be a bit proactive and even ask the questions for interview panel as well. This will create a good feedback upon your application itself. Now, tips for successful interview. I would say prepare early. The more early you prepare, the more likely you're going to succeed in interview. Prepare, make a small group around with your friends, or ask if you know someone who has recently passed an interview and got a NHS job. Ask them to guide you and prepare as early as you can. Smile throughout the interview, because they would be looking at how natural you are and how pleasant you are, because essentially you'll be working as a colleague to them as well, the interview panel. So smile throughout the interview, understand the role again, sharpen your clinical skills, and always ask question in the end. This is a really important tips for a successful interview. Now, once you have once you've selected in the interview, then you'll get an email saying that you've got a conditional offer of employment. So a conditional offer of employment is basically means you're signing a contract there. So this include how your rotas would be, what is your on-call shift, how much what is your what's the duration of your contract, and all these things. So this is called conditional letter of employment. Once you accept the conditional letter of employment, essentially means that you're accepting the job. So after that, your referees would be checked and your identity would be checked as well. All this criminal record checking and will be done. And finally, if you require, you'll get a certificate of sponsorship as well. Now, a role of SHO. I'm not going to go in a very detail regarding this, because it differs from which grade you're working, which area of you're working, which specialty you're working, and which trust you're working as well. So, but basically, a role of a SHO or a junior doctor is carry out daily ward rounds, jobs like cannulation, blood result review, update family, prepare discharge letter, clerk a patient and everywhere, review unwell patient, and liaise with senior nurses and other colleagues. It's a different. As I said earlier, it differs from the specialty you work and from the areas you work as well. So revalidation and appraisal. So once you are GMC registered, there are a few things that needs to be done, which is a GMC requirement, is a revalidation in appraisal. So revalidation, you need to have a designated body and and an appraisal throughout, which means that once you've got a non-training job or as such a job, then you'll have a designated body. And your revalidation and appraisal depends on the trust policy essentially. In my trust, our curriculum is very similar to internal medicine training. There are a few things and few tick boxes that I need to finish before 1 year, and I need to discuss with my clinical supervisor to say that I have completed appraisal for 1 year. And we use a different portfolio system as well. So it's a very different topic, and it's a very complicated one as well. Once you get a job, it's kind of easier to go through it. And even if you are a non-training job, you'll get a clinical or educational supervisor. So there will be a consultant or senior will be there to guide you and to help you out with your day-to-day difficulties, or even plan your future career or ambitions. So there will be a clinical or education supervisor for that. And finally, once you completed all these things, you can also sign a CREST form with your clinical or education supervisor. So let me show how a CREST form looks like. Anyone can sign CREST form. Doesn't matter if it's going to be from UK based consultant or consultant from back home, but he needs or she needs to work with you for at least 3 months to sign this CREST form. So basically, CREST form essentially means that you've got you're kind of ready to enter into a specialty training. So basically, it means that you have completed your foundation level competencies. So the foundation level competencies essentially means that you are all right to see patients on your own. You're ethically sound. You can work as a team player. You've got essential skills and everything, which is and then they can sign it, and it's once you've signed it, you can upload it and you can use it for the training roles. So what I did was I joined this trust in June 2021, and I downloaded a CREST form. And in my first meeting with education supervisor, I kind of made him aware that I would ask him to sign a CREST form in November. And we had a brief discussion, like what are the things that what are the criteria that I've already met, and what are the further things that I need to work on for this CREST form to sign on. He asked me to do a few things, and I did that few things, and like he essentially signed me my CREST form. So basically, once you've signed your CREST form, it means that you are eligible to apply for the training post. All right, so that's all for my presentation for today. If there is any questions, I can answer.
Yes, Dr. Sagar, if you can briefly tell us, what did you do to get your CREST form signed, just in brief?
Right. Okay, sure. So in my context, I use a portfolio. So basically, a portfolio means that it is very similar to what we call back home is a small diary, that what we write down from day-to-day activities, all the procedure that we do, and it is signed by our seniors. We call that as a portfolio. I use a portfolio which is called JRCPTB, which is Royal College approved portfolio, which is of course I have to purchase it. So once I purchase that portfolio, there are a few things that I've done. So first of all, it's called multi-source feedback. So with all the colleagues that I've worked, I asked them to provide me a feedback, and if there's anything that I need to work upon, and that's called multi-source feedback. The other thing is clinical case-based discussions, like if there is any case that I saw with my consultant, and I used to discuss it with him, and then he would write down the feedback. The other is if there is any procedure that I did, then I would sign as a DOPS, and then certain things. So in my trust, what the trust policy is like, if you have completed 1 year of ARCP, and if you have passed your ARCP, then you're eligible for your CREST form to be signed. So in my trust, there are few numbers that needs to be fulfilled, like 5 CBDs, 5 mini cases, or one MSF or something like that. So however, there are different situations in different other trusts. Some might not say you might need all these things. It just depends on which trust you're working. Basically, it's not that difficult to sign a CREST form. What I would say is it doesn't have to be from your educational supervisor. It can be from any consultants, whom we have been working for 3 months. We're happy to sign it for you.
And some of the other requirement of CREST form is also to work as a team in an arrest situation, cardiac arrest situation. So you might need to have an advanced life support certificate for that one, and also the involvement in the quality improvement project as well. Okay, so now we will open the floor to questions. I can only see a few questions so far. So what is a Horus portfolio? We'll not answer this question now because that's going to be the next section in the FY2 standalone program. Yeah, so a few other questions. We'll go very briefly now. Is it recommended to complete MRCP1 while waiting for the job? Now, I can answer this question. MRCP1 is not the essential criteria, but the desirable criteria in most of the job application. And it's always going to be easy if you have completed MRCP Part 1 to join the internal medicine training program as well, because it's also the desirable criteria there. What if we have never worked apart from our internship? Will it be difficult to get a job? Yes.
Right. So as I can see, everyone are asking whether we need MRCP Part 1 or audit or research or anything. I would rather say focus on your job application itself. Make it, understand the role first, demonstrate your quality there, work on your presentation, work on your job application itself rather than anything else. It might be difficult to get a job, if you've not got any other employment history apart from your internship, but it is not impossible. As I said earlier, it's mostly how you fit the role, basically.
Yes, and Dr. Ranjana asked, can we do audit from home country? Absolutely, yes, but it should be well documented as well. Yeah. In UK, it's always a standard because you've got audit department and you can get the certificate directly from the audit department from the trust. How essential are researches, clinical audits, or teaching experience for job application? Yes, Dr. Sagar.
Right. I would say if you've got those, include that, because that would create an impact certainly. But if you've not got those, what I would say is, I'm sure like everyone has got teaching experiences in back home. Because while we were interns, we used to at least teach, or at least demonstrate our fellow medical students. So even that is a teaching experience. Whatever kind of, be it formal, informal, include that in your job application. So whatever even if you taught your fellow colleagues during final year exam or anything, that's a teaching experience itself. So whatever you do, whatever, even it may sound, even if you think it might be irrelevant, include that in the job application itself. So that will essentially help you to get your job.
I'll take one last question. Is there any age barrier to join GMC?
No, I don't think so.
I don't think so as well. So I will close the floor for the question now. We will now enter into the next section. So like Dr. Sagar said, this is one way to get your CREST form signed and enter into the training program, but there is another way as well, which is called FY2 standalone program, where everything is standardized. You don't need to get your CREST form signed. It's a standard training program for from UK Foundation Program Office. And Dr. Sagarab, who is one of the core surgical trainee, have gone through this route, and he will be explaining about FY2 standalone program.